Good morning, guys. Welcome to Nursing Short Quiz number 1. I'm that Pinoy nurse. So let's head on to the quiz. Number 1. Nurse Dennis is a staff nurse at the post anesthesia care unit for 5 years now. He knows that which nursing diagnosis has priority among clients in the PACU. Letter A. Acute pain related to discomfort of wounds and immobility. Letter B, body image disturbance because of wound dressing and drains. Letter C, ineffective airway clearance related to general anesthesia. Letter D, ineffective thermoregulation related to post-surgical operation. So you can pause the video if you need more time to answer. Okay, so let's check. The answer is letter C, ineffective airway clearance related to general anesthesia. Always prioritize your airway. Always remember your ABC, airway, breathing, and circulation, especially in the PACU or the post anesthesia care unit where patients usually have undergo surgery and have general anesthesia, which can impair their respiratory system. Okay, next number we have number 2. Nurse Tom is giving discharge instructions to the client's relative. Which of the following remark indicates that the client's relative understood the discharge instruction for wound care? Is it letter A? If the wound is painful, I will say it is normal. Letter B. It is alright to use adhesive tape over the wound to keep it intact. Letter C. It is okay for his pet to remain at his bedside to keep him company. Or letter D. I will report any redness or swelling of the wound. Once again, you can pause the video to have more time to answer. Okay, let's check. The answer is letter D. I will report any redness or swelling of the wound. So redness or swelling is a sign of infection. So as you can see, the stem question or the stem of the question is which of the following remarks indicate that the client's relative understood the discharge instruction for wound care. So the focus here is wound care. Letter A is focusing on the pain of the patient, and adhesive tape is not to be used over the wound. Okay, and letter C is not related. So the pets being at the bedside is not related to the question. So the best answer for this is letter D. I will report any redness or swelling of the wound because this would indicate a sign of infection. Okay. Next number, we have number 3. Daniel, with multiple myeloma, complains of deep bone pain. As his nurse, which of the following will you do first? Is it letter A, assess bone pain? Letter B, administer prescribed analgesic? Letter C, teach pain relief strategies? Or letter D, support position with pillow? Okay, so do you have an answer now? Let's check. Correct answer is letter A, assess bone pain. Remember your nursing process. So especially in the board exam or any exam in nursing, you have to remember your nursing process. It's the ADPI, assessment, diagnosis, planning, implementation, or evaluation, or in intervention and evaluation. So first, so the question is which of the following will you do first? So in the nursing process, it is always first to assess. Okay, assessment is always the first thing to do in the nursing process. So always remember that when you're dealing with a question that pertains to the nursing process. Next number, we have number 4. You are taking care of Arnold, who is complaining of severe abdominal pain. What do you think is an important responsibility related to pain that is subjective in nature? Is it letter A, divert attention of the client in pain? B. Leave the patient alone while in pain. Letter C. Believe what the patient says about the pain. Or letter D. Assume responsibility to eliminate pain as described by the client. Okay, let's check. What's your answer? So we have here the pain. Letter C is the correct answer. Believe what the patient says about the pain. So since pain is subjective in nature and is considered as the fifth vital sign, so according to Kujier, it is essential that nurses listen to and believe the client's statement of pain. Believing the client's statement is crucial in establishing the sense of trust needed to develop a therapeutic relationship. So, since pain is subjective, meaning only the client can perceive the pain, so it is our responsibility or the nurse's responsibility to believe the client when he or she is complaining that she or he is experiencing pain. Okay? Number five. A patient was rushed to the emergency room. Upon assessment, the nurse noticed that the patient's blood pressure is 70 over 50. What nursing intervention would the nurse initially do? We have letter A, call the physician. Letter B, give the butamine IV drip. Letter C, give plain NSS, IV bolus. Or letter D, place the patient in Trendelenburg position. Okay, so if you need more time, you can pause the video. So let's check. The answer is letter D. Place the patient in Trendelenburg position. So this is considered as the nursing independent intervention. Okay, so calling the physician as a nurse, it is our responsibility to do independent intervention first before we call the physician. Because if we directly call the physician without doing any intervention, then the situation or the status of the client might get worse. Okay, and then giving the butamine and plain SS are considered as dependent nursing intervention because this will require you to have a doctor's order or a physician's order for you to be able to give this kind of medications. Okay, so those are the five short nursing quiz. How well did you do? If you like the video, please give it a thumbs up or like if you think if, it was helpful. Share if you want to help or challenge others. So subscribe to stay updated. I will be posting videos once a week or short quizzes once a week just to keep you enhanced on your nursing knowledge. Comment if you think it was too easy or if you have topics you want me to make a short quiz for you. Thank you for watching this video. I'm that Pinoy nurse. Always stay interested.